And good morning, welcome back. All right, I've got a name for you. It's Donna Wahoff-Stice. Did I get it, Donna?
Yes, you did.
Okay, I've been practicing. Donna is in here with us. She is a nurse practitioner at the University of Utah, as well as People's Health Clinic, and we're very happy to have you. And you wore your snowflake because
it's snowing
Merry Christmas.
Outside.
Merry Christmas is what we're going to talk about today. No, I'm kidding. We don't want to talk about that, but can you believe this snow?
It's great.
You can believe it, right? You're talking it's great? Oh, my heavens. We need to get you on the couch with me and Carolyn, because me and Carolyn in the morning, we just sit and whine.
I'm a Nordic skier, so I love it.
We have the Park City Nordic team coming in just a little bit. You might need to hang out. But Donna, again, we're going to talk about, like I told you earlier, type 1 and type 2 diabetes.
Yes.
Also about how many people have it and that it's preventable, which I know that I've seen in my family alone. I know that several family members have it. I know several friends that have it as well. But let's talk about the difference between type 1 and type 2 first.
Okay, type 1 diabetes is an autoimmune disease. And so there are no lifestyle choices that influence getting type 1 diabetes. But only about 10% or less of people with diabetes have type 1 diabetes.
That few.
Those individuals must be on insulin or they'll die. So that's type 1. Type 2 diabetes is 90% of the population. Those individuals tend to have some genetic components to developing type 2. So you see more in a family and multiple family members.
So it is fairly, I mean, when I say fairly common, how common is it to have it come from genetics?
Oh, I don't know that I can give you a number for how common in genetics. What it is you have a propensity towards that, and it's probably being overweight and how you gain weight. But then there's also non-genetic factors, which are that weight gain and lifestyle. Many people in Park City don't have diabetes, at least the Caucasian population.
Is that because of how active we are?
It's the activity level. People have more leisure time. They're able to eat healthy and exercise. But if you look at our Latino population, their risk for diabetes is close to 12%, as well as for the Native American population.
And why is that?
It's genetic, and it's also lifestyle. If you look at the types of foods that are endemic to our Latino population, it's rice and beans and lots of carbs that tend to make you gain weight. And these folks are also working multiple jobs. They don't have time to exercise.
Right. So exercise is obviously one of the ways it's preventable.
That's right. There was a great study called the Diabetes Prevention Program where they took people who had impaired glucose tolerance and they gave them intensive lifestyle management, so diet and exercise. It reduced the number of people who went on to develop diabetes by 58%.
Wow, that much.
They compared that to a common medication, metformin. That reduced progression by about 35%. So we know diet and exercise works, but it's really, really tough.
But we're talking exercise. We're not talking the fact that you're just, are we talking like a leisurely walk, or does it matter?
A leisurely walk helps.
Okay.
A leisurely walk helps, but obviously you have to do that for more time than if you're, you know, I tell my patients that you want to break a sweat. You want to be breathing hard because you're working hard.
So walk in town, Park City, or in the hills of Pinebrook or anywhere.
I recommend to my Latino patients a lot walking on the rail trail because in the Latino culture, people walked the squares in the evening. They got out and did just basic social walking. And we would like to get more walking groups going for these people.
Well, we do really have an active lifestyle here in Park City. A lot of people move here to get out on the slopes, to get out on the trails. I mean, you've got great seasons for it. Our winter continues to keep on going. It's the winter that keeps on giving. But you've also got, you know, great summers that allow for some incredible mountain biking, rail trail. You can head out on the rail trail or just even the walks you can go on. So it really does create an active lifestyle. Let me ask you, Donna, when you told me that you wanted to talk about this topic, is it because you're seeing more people diagnosed with type 1 and type 2, or is it something you want to make people aware of?
It's both, because 24 million people in the United States have diabetes, but there are double that number or more who are pre-diabetic. And that means that within the next 2 to 8 years, they're going to develop diabetes. And the disease is very costly. There are over 40,000 amputations a year due to diabetes.
Really?
There are over 12,000 people who lose their eyesight a year because of diabetes. And we have 178,000 people every year who are on dialysis or have had a renal transplant due to diabetes.
And type 1 and type 2 are preventable? Or is one more preventable than not at all?
Not at this point. There are studies working on developing that. But type 2 is the one that we can prevent with lifestyle. Or at least, I'll ask you a quick true or false question here. Diabetes causes amputations, blindness, heart disease, kidney failure. The answer is false. It isn't having diabetes. It's not treating it. It's high glucoses. So if we can discover the people that have these high glucoses, treat them appropriately, we can decrease the cost to the individual. It's not great to go blind, but we can also decrease the cost to our healthcare system.
Absolutely. So, and you're at University of Utah as well as People's Health Clinic. Let's go over the difference of both. Just, are you up here at the Park City one as well as in Salt Lake, or just Park City?
Well, no, as far as the university, I'm only in Salt Lake.
Okay. Okay, so you're down in Salt Lake. People can come see you for, I'm sure, a lot of different reasons, but if they are curious about diabetes, you are there.
I'm at the Utah Diabetes Center. You can find it on the internet, and you can look up the services that we have. We have a fabulous education program.
Wonderful.
And great providers as well.
And then People's Health Clinic is wonderful for people that don't have the insurance to get into the doctor's office.
Correct. With our current economic climate, our number of clients is growing dramatically.
I'm sure.
We have a very high percentage of Latino clients, but we're seeing more Caucasians as well who no longer have insurance. So we can provide a good quality care at little or no cost to them.
And you know, People's Health Clinic, I mean, we do have to thank those that are helping fund, helping to really keep it alive, because you think about times like this and like you're saying, more people are going in and we still need that funding. So if people are able to give to People's Health Clinic, I know you do a lot of different fundraisers. You just recently had one with the big fun, what is it? Not the gambling night. I know you can't say gambling, but whatever it's called. Casino night. Yeah. There we go.
Well, and the food and wine is coming up in July. And
yes,
they also, there's an auction for benefiting the People's Health Clinic. I believe that will be held at the Canyons.
And now, is it the Food and Wine Classic that helps benefit you guys? I didn't know that.
Yes, there is a benefit.
Oh, that's great.
I was just reading that.
Oh, good.
So I'll volunteer and be there.
Yeah, I'll volunteer. We'll all be there, right?
Right.
Well, Donna, thank you so much for coming in. Again, it's always great to have our doctors in. We try to have doctors in on Wednesdays to keep you in that Wellness Wednesday mode to really know what's going on. Donna, we'll have to have you back. Are you going to wear, so if it's sunny and clear, do you have a sunshine?
I'll wear something else, yes.
Okay, perfect. She's going to be our weather forecaster. We'll just bring her in here. Depending on her outfit, on Donna's outfit, we'll know what the weather conditions are like.
Well, thank you very much.
You're very welcome.
I appreciate being here.
Absolutely. Stick around on the Mountain Morning Show. We're going to talk with the Park City Nordic team. We've also got a lot more coming up on the Mountain Morning Show weather trivia. It's all coming up. Stay tuned.